in the fight against it. And this 4-week-long series that we're going to bring you will have stories of triumph of Ghanaians who faced this, one of humanity's greatest enemies, and won, whose family members faced it and won. We will also hear from those who weren't so lucky, whose family members couldn't really survive when they encountered this great human enemy. But all of this is to tell us that the war is still raging. It has been raging for millions of years and it continues to rage. But together we can beat it. What's this enemy I'm talking about? It's cancer.
Yeah.
Cancer, one of the greatest killers. And in fact, it is how horrible the death from cancer can be that makes it such a terrible enemy. But it is a defeatable enemy. And we'll be figuring out how to do that together. In fact, it's a series on cancers for 4 weeks. We'll be bringing you all the experts, all the survivors, all those who have experienced it. We'll be talking to people who attack this disease from every angle, whether it's research, medicine, treatment. We will be talking to all the fighters on the front line in this war. And then we'll figure out how you and I can be enlisted to help win this battle, this centuries-long battle against cancer. Now, to start things off, I want us to talk to one of the greatest collaborators of our show. He's a friend of the show that doesn't need a lot of introduction, but you might know him as the Drive Doctor, Dr. Yaw Osafo, CEO of Medicas. Not only is he the CEO of Medicas, but on this series that will be running for the next 4 weeks, he's our resident consultant. Dr. Yaw Osafo, good morning to you, sir.
Good morning, Kojo.
Yeah. It's always a pleasure to have you on the show. And
pleasure is all mine.
Yes, indeed. And this conversation is important.
Very.
Yeah. First of all, I mean, let's sort of outline the goal here. What are we hoping? What would be success by the end of this 4-week series?
Right. So good morning to all of you. Good morning, Winston. And I'd like to say congratulations, even before we start, to Multimedia, Joy FM, for making the time, given 4 weeks for us to talk about something that I know that we are all afraid of. So, because most of the time we say the C word, we don't want to mention the whole name. But yes, we're going to talk about cancer. And success would look like this. Everybody in Ghana gets a minimum, a bird's eye view of what cancer is. We want people to tune in. If we ask that SHS student, what is cancer? What are some of the risk factors? And what can we do to beat it? It should be able to tell us a thing or two. And that would be the first step to winning the war against cancer.
Well, that's a lofty ambition, but if we're able to get anywhere near it, I think it would be success. So let's start from the beginning. For those who are tuned in right now and thinking, okay, so cancer, we hear about it, but what is it?
Good. So we know that October is pink, or has been labeled Pink October, Breast Cancer Awareness Month. So we're going to focus on this disease. And Kojo, I'm going to share with our listeners why it is important, why the Super Morning Show is going to dedicate 4 weeks to this. The International Agency for Research on Cancer, which is a WHO's cancer agency, has some very sobering statistics. In 2022, there were 20 million new cases of cancer, different types of cancer. Could you 20 million new cases?
New cases of different types of cancer.
Yes, of cancer.
Hey.
And there were 9.7 million deaths on record. And Kojo, I will tell you that this is an underestimate because when it comes to death registration, we have challenges globally. But 9.7 million deaths from cancer in 2022. The agency projects that by 2050, there will be 35 million new cases. So, Kojo, if we don't do anything to buck the trend, then we are moving from 20 million new cases to 35 million new cases by 2050. Again, the International Agency for Research on Cancer says that about 1 in 5 people will develop cancer in their lifetime. Oh, that is a very frightening statistic. Again, if we don't do much to stop it. Lung cancer, female breast cancer, and colorectal cancer, that is cancer that affects the large intestine, are the 3 top cancers globally. Globally, these are the top 3. So in simple terms, when we talk about cancer, we're talking about disorderly growth of cells. Because we are made up of cells, trillions and trillions of cells. A group of cells will come together, or cells will come together and form tissues. Tissues will come together to form organs. Organs will come together to form organ systems. And then the various organ systems come together to form the organism. So you and I are made up of cells. And the cells have specific programs within them that tell them how to grow, how fast to grow, and when to stop growing. But unfortunately, this program sometimes becomes distorted, either because of genetic factors or environmental factors. And we will look at some of these risk factors. And therefore, when this happens, you have disorderly growth of cells. And that, in very simple terms, is what cancer is about. So in the next 4 weeks, what are we going to do? We have put together experts who are involved in cancer diagnosis, cancer research, and treatment of different cancers. We are going to take a deep dive into the different types of cancers. We will be looking at the risk factors for developing cancer. And if the International Agency for Research on Cancer tells us that 30 to 50% of all deaths can be prevented through lifestyle or environmental changes, then we should all set up and realize that there's a lot that we can do. So in the first week, we will just give an overview of cancer. We will get in different experts to talk about a different, just a bird's eye view of cancer. Then in the second week, we'll take a deep dive into important cancers that affect men. The third week, we will look at important cancers that affect women. And then in the last week, we will look at important cancers in children. Yes, unfortunately, children do develop cancer. So we'll look at important cancers that affect children and also look at some rare cancers or not so common cancers like the leukemias, the lymphomas, which are blood cancers. We'll look at that. But Kojo would also be sharing survivor stories. It's very, very important that we hear from those who have had the diagnosis, have gone through therapy, and have come out of therapy and are continuing with their lives. I think it's very, very important that we share their stories. So every week, at the end of every week, we will share a story from the different groups that we are going to address. And we would know from the scientific perspective, and then we'll also know from those who have gone through it. So it is very, very important that we all tune in and never miss this. We shouldn't be afraid of cancer. Early detection makes a world of difference. And then also lifestyle changes can also make a contribution. And since we are on the Galamsey thing, it is very, very important. We will hear about how some of these chemicals that we are hearing about in Galamsey also make a contribution.
These are some important, crucial conversations. I mean, for the month of October, the advice is do not miss the Super Morning Show. Don't miss it. Don't miss it at all. These are conversations designed to save life, right? And you've got to be a part of it. Doc, just before you leave us, you've given us a very clear picture of cancer across the world. I know that in Ghana we struggle with statistics and data and all of this, but what's it? How is Ghana doing in the fight against cancer?
Right. So when it comes to cancer, we started treating cancer in this country. We've had many years of experience, but it has been very limited until, for example, the National Health Insurance decided that, for example, breast cancer was going to be added to the coverage. So we haven't done too well. And when it comes to cancer inequity, treatment inequities, yes, you look at it and developing countries show that the greatest burden of deaths from cancer. Then if you go to the subpopulations, so for example, pediatric cancers, for example, we don't have a lot of treatment centers. Okay, I have a colleague who's in charge of the treatment center at a Rich Hospital. They can be better resourced. So cancer treatment centers in this country, I think about six or so centers where you can treat cancer. And that is not enough for a population of 33 million. So we need to push. Most people have to go out of the country for different types of treatment and investigation. We still send specimen or biopsies outside this country to South Africa, to India, to clinch a diagnosis. And all those things are things that we need to improve. But if I look at when I entered medical school in the year 2000 and where we are now, in terms of capacity for diagnosis, we've made some great strides. We're a long way off from where we should be by the WHO standards, and there's a lot that we need to do. And I'm hoping that through this conversation, policymakers and those who are burdened with managing the healthcare space will get insight as to the scale of the problem and not just leave the challenge to frontline workers.
That's an important note there, and that's actually one of the reasons why we're doing this, because we really want to improve Ghana's fighting ability when it comes to cancer, and we'll be figuring out together how we can all contribute to that. Dr. Yaw Osafo, we're so grateful for you, for you opening the gates on our Cancer Awareness Month. We appreciate it very much. And you will be hearing a lot more from Dr. Osafo as the 4 weeks unfold here on Joy. So yeah, now you know what we're doing. And listen, it's a big problem we're trying to solve. Every 3 minutes, someone in Africa is diagnosed with cancer. But of course, what you need to know is that many cancers are preventable. And of course, when you catch them early, many of them are treatable. So throughout the month of October, Joy 99.7 FM presents the Cancer Awareness Month. It is a comprehensive 4-week series bringing you Ghana's leading cancer experts who are going to be discussing the cancers that affect our community. So whether it's breast cancer, or prostate cancer, childhood cancers, blood cancers, our expert doctors will answer all of your questions, and of course they will share life-saving information about prevention, early detection, and treatments. We'll be hearing some survivor stories. Those are the inspiring ones that I don't want you to miss throughout the month of October here on the Super Morning Show. And of course, we'll be featuring pathologists, surgeons, oncologists, and of course, cancer survivors who'll be sharing knowledge that could give you life, or of course, save the life of someone you know. Cancer Awareness Month is October on Joy 99.7 FM, because when it comes to cancer, what you don't know can hurt you. All right.